Today we'll be here talking about understanding a new healthcare system and cancer care system as a newcomer. First of all, welcome to the Patient and Family Conference. It's an honor to be here with patients, families, caregivers, and community members. You bring so much insight and lived experience to this space, and it is appreciated. We know that navigating cancer can feel overwhelming. And for a newcomer who is trying to adjust to a new country, a new healthcare system, a new set of beliefs, it can even feel more complex for them. And that's what makes the work that Cancer Care Manitoba is doing in partnership with the Canadian Partnership Against Cancer very important. And today we'll just be sharing more information on the work that we've been doing, and then we'll also be providing some guidance in how to access some supports and services that currently exist. So an overview of today's discussion, we'll start by sharing some real insights that we've heard directly from newcomers about the barriers that they face and how the Newcomer Model of Care project that we're working on is helping to bridge these gaps. Allison will also be helping us to provide some guidance on accessing available resources and cancer care services in Manitoba, as well as we will be demystifying common cancer myths together, some misconceptions, just so we can be able to better understand the truth and also be able to empower and provide more confidence to newcomers so that they can be more confident in accessing cancer care services. So the Newcomer Model of Care project, like I mentioned, is a project that is aimed in improving the cancer care experience and outcomes for newcomers in Manitoba. And the main objectives of the project is to engage our key partners, which are newcomer serving organizations, community members, healthcare providers, to be able to co-develop a model of care that can help address these barriers that exist so that newcomers can, in the long run, have better health outcomes. Our other objective is to co-implement this model of care together to be able to improve access to cancer care services and experiences in a way that considers newcomers' beliefs, values, and preferences. In short, in just a way that's culturally safe for them. So the project is going to be going till 2028, and it started in 2023. But despite this, as we are implementing this work, we are thinking of sustainability and ways of ensuring that this work continues beyond the life of the project. I'll just start by giving us some background. In May to October 2023, we had an engagement phase, and this is where we held key informant interviews with settlement providing organizations, healthcare providers, which included primary care providers, psychosocial oncology clinicians, and also we had an interpreter service coordinator, as well as ethnocultural organization and faith-based organization. And when this happened, we heard directly from the community, and some of the things that were shared were some of the barriers that prevent newcomers from accessing services are things like language barriers. For example, not having maybe interpreters available that can speak certain dialects, or not knowing about the services that currently exist, whereby you can have an interpreter support you when you're receiving care, and then feel like maybe the only person that can provide interpretation is maybe your child, and you wouldn't want them to hear any bad news if that was what was going to come out of it. And then another thing is maybe coming to a new country and you haven't formed a community of support yet, and you're wondering, if I go to the hospital, who is going to take care of the kids for me, and maybe not knowing that there are supports that are available for that. And also maybe having difficulty accessing primary care, not knowing that it is important to have a family doctor, because maybe the country you're coming from, the healthcare was privatized and there was no need of having a family doctor. So when you come here, you're not sure how the system works. The other thing is not knowing whether you'd have to pay for services because maybe from the country you're from, you're usually used to paying for services and might come here with the same assumption. So you avoid accessing the healthcare services because you feel like you are not in a position yet to be paying that and because you're just trying to settle in. So these were some of the barriers that were identified. And that is where this now Newcomer Model of Care project like steps in to try and see what are the barriers that we can address. Is it by creating resources that address some of these barriers, like providing more education, demystifying some of these misconceptions that exist so that we can be able to empower newcomers to be more comfortable in accessing these services. When it comes to things like language barriers, is by maybe providing information that there are interpretation services that exist, and maybe this is where you go. And the other thing is that as part of this project, we're also working on developing some videos that provide some information on things like understanding cancer screening, your role in your own care, which now empowers them and like lets them know about some of the rights that they have, a snapshot of how to understand referrals and accessing services. So yeah, these are some of the resources that we are co-developing together to try and have resources that address these barriers, which in the long term would help improve the newcomers' healthcare outcomes. As part of our work, we also maintain continuous engagement with our communities just to continue to hear from them and implement the voices that we're hearing in the work that we're co-developing. And what we have in front of us is some of the voices that we've heard directly from the community, sharing some of the thoughts that they have and some of the beliefs that they currently have. And some of them I will just read and go through them. Like the first one, we had someone that mentioned, like, if they go in and they get checked and then they find something, what's next? They just got their PR and they don't want to be deported. And that's, as we can see, it's a valid concern because someone might come in and they don't know what happens, because if maybe in their country they would have to pay for the care, and now they've just come to a new country and then they've been diagnosed with something like cancer. Does that mean they'd have to go back to their home country? We'll talk about this shortly. And then another voice that we had was saying, I got a letter in the mail. Does that mean I already have cancer? We've had this over and over in the community, whereby sometimes the letters that are received from CCMB, some people are afraid to open them because they feel like it's a notification from Cancer Care Manitoba that they do have cancer. And we will also talk about this shortly. Another thought that we had directly from the community is that my family thought my diagnosis meant I was going to die, and it was really devastating. And this is some of the things that the community continues to tell us that are important things to try and see how we can address them, because there are real concerns that exist, and there are some of the things that continue to keep newcomers away from accessing cancer care services. Another good example that we had and felt like it's important to share is one member of the community mentioned that they felt fine and they have no symptoms, so they feel like they're healthy and they don't need screening, because according to them, they feel like screening is for people who have symptoms. And then another member also said that they have other priorities and responsibilities. They feel like they can't afford to miss work and go for a medical appointment if it's not something serious. And as we can see, these are really valid beliefs that one may have, but sometimes maybe some of these beliefs can be true, or maybe they are just around some misconceptions and myths that currently exist. But now I will hand it over to Allison to go through this with us to see what we think. Do we think that some of these are true or false? And then we can just have a discussion when it comes to that.
Thank you so much, Princess, and thank you for outlining some of the exciting work that we are doing right now with newcomer communities, people with living experience of coming to Canada are experiencing this new system and this new setting and seeking health services. And also that work, it's exciting that we can connect and build relationships with newcomer serving agencies or services, and key resources that are really important to the people who are trying to navigate this new system. So Princess has done a great job of laying out some of these examples of what we're hearing from people in the community, what it's like to come to Manitoba and have to navigate a health system that is new and different, especially where fear is involved and there may be misinformation or differences in the way that we understand certain parts of health and health services. So now we're going to go into a bit of a interactive way with those who are on the webinar, where we're going to put up some polls, and we're going to ask that you answer these polls that come up, and then I'm going to respond to your questions and try to demystify some of the myths we're hearing or respond to those common questions. I myself am a healthcare provider. I have been a nurse working in the cancer setting for about 17 years and have had the honor in almost the last decade of working with many folks who are new to Manitoba and navigating that health system as a navigator and as a liaison nurse, supporting people's access to care and a good experience that is meaningful to them. So now I'm going to ask that we put our first poll up and we hop over to the first slide where we're going to give a true and false question. So if you just got your if you just got your permanent residency, so the PR is permanent residency, and you get diagnosed with cancer, you could be deported. Is this true or false? I'm going to give you about 30 seconds to a minute, and then we will see what the results are. Okay, are we able to see what those results are now? Close the poll and see what we see. Okay, so everybody answered correctly. That is absolutely wonderful to hear. But I want to still discuss this because it is a question that comes up. So there is deep concern that having to access cancer services is going to mean that it's going to compromise or put someone's permanent residency or their residency at risk. So what will happen and how will their immigration status be affected? It's important to know that cancer care and cancer services is totally confidential. This is a health journey, and we have laws in Canada and in each province where we don't share personal health information without permission or very significant reasons why we have to do that. Otherwise, we could all, as healthcare providers, our own licenses could be compromised. So we don't share that information unless we are given permission to do so. I also want to say that people who have permanent residency are absolutely eligible in Manitoba to receive health services. So people eligible for Manitoba health coverage, that's our health coverage in our province. Those who are able to receive that coverage are Canadian citizens, Indigenous people who are registered under our Federal Indian Act, permanent residents, and people in Manitoba who have a valid work permit. Um, now, in saying that, there is some conditions where people who have a work permit may have their coverage lapse, and it's important to be aware of what those things are. As well, people who are refugees. Refugees or protected persons defined by Immigration and Refugee Board of Canada are eligible for health services. They're covered under the federal government, but they're eligible for health services within the province. Now, what's really important is people need to have made Manitoba home. So, if Manitoba is not home, even for somebody who is a Canadian citizen, they can't access health services outside of some very specific things within our province. So, as an example, cancer care is only available to people in Manitoba except under very exceptional circumstances. So if somebody from Alberta decides that they want to receive healthcare in Manitoba, even if they're a Canadian citizen or a permanent resident, they all have to receive those health services in the province that they call home. If they choose to move to Manitoba and they live here for 3 months, then people become eligible for health coverage in Manitoba. So now we're going to move on to the second poll. So the second poll will pop up on everybody's screen really soon. Receiving a screening letter means you already have cancer. Or if a letter in the mail comes from Cancer Care Manitoba, this means I have cancer. Is this true or false? Okay, let's see the results. False. Amazing. I also wonder who's all answering these questions. I'm glad to see that we get all correct in answers. Now, again, we still want to cover this because this is a question that comes up regularly. I can remember a situation where someone called me when I was a nurse navigator because they received a letter in the mail from the screening program to invite them to be screened. And that scared them, and the family members in the house as well, and their loved ones all thought that this meant that the person who received the letter had cancer, and everyone was devastated. It's important to note that here in Manitoba, we have a screening program where we send letters out to people who are eligible for screening, and we invite them to participate. These letters have instructions on how to do a screening test, how to access a screening test, so whether they get a kit in the mail or need to request a kit in the mail for colorectal screening or screening in the colon or where food is digested and then forms into stool or poop and then leaves the body through the rectum and the anus. And we're able to screen through something called a FIT test, or if they are requiring breast screening. Breast screening can be accessed through making an appointment through a mobile van site or at one of the fixed sites, such as the site at 25 Sherbrooke on in Winnipeg, where people can make an appointment and attend in person to have their breast mammography. This is where we take a test similar to an X-ray, but where we put the breast into a machine and we're able to visualize potential sites that need to be investigated further. Now, it's important to note these screening tests do not diagnose cancer. They tell healthcare providers if further tests are needed to rule out or confirm if cancer is present. So even if somebody has had breast, cervical, or colorectal screening, and something needs to be looked into more, this just means that more investigation or more has to be done to figure out what it might be. It still may not be cancer. Only a portion of the results that need to be have further investigation will demonstrate cancer. And when we look at all the people we screen in Manitoba, there's a very small number that get diagnosed with cancer. But when we do diagnose, it's very important because we can catch it really early. If people do get connected to Cancer Care Manitoba, so where somebody has already been diagnosed with cancer, they'll get a call from Cancer Care Manitoba. We typically don't have the first way of connecting to somebody be a letter. So the screening program will send letters of invitation. Cancer Care Manitoba will typically call when we need to connect with somebody who has been diagnosed with cancer, and they will very likely already be made aware of that diagnosis with their healthcare provider, which could be a nurse practitioner, a family doctor, or maybe in some cases emergency rooms or other specialists. Sometimes when people are already connected to cancer care, we will send appointments out or forms that need to be filled in, or requisitions for specific tests. But this is again once people are already connected to Cancer Care Manitoba. Um, I will mention that Cancer Care Manitoba also provides care to people with blood disorders or hematological diseases. So these are not necessarily cancers. They are often these blood disorders, non-malignant or non-cancerous blood disorders. And our hematologists in Manitoba are working within Cancer Care Manitoba in most cases. So that's where some people might receive a call or a letter from Cancer Care Manitoba where they do not have cancer. Let's pull up our next poll. I feel fine. I'm healthy. I don't need screening. So we've heard this many times. And so our question is, you only need cancer screening if you have symptoms. Is this true or false? Okay, let's see the answers. False. Again, we're getting our test is demonstrating that everybody's getting it right. I really love to see this. So screening is for people who have no symptoms. This is for people who feel healthy, and the goal is that we find cancer early when it's the easiest to treat. So, screening tests help us find some types of cancer before symptoms even show up. It's important to have these tests even if people are feeling fine and people have healthy lifestyles. They're part of regular medical care, and we're very privileged in Canada to have screening programs where they may not be available in all parts of the world. If you're in a certain age group or a population group in Canada, you can go for regular screening tests that can help find breast cancer, cervical cancer, colorectal cancer, and in some places, lung cancer. And the goal is to catch it at an early stage where we're able to treat it a little bit more easily. Some screening tests can even help prevent cancer from even forming or catching cancer before it's turned into cancer when we can see pre-cancer. The benefits that we see of regular cancer screening is that getting screened often reassures people when they have normal results. Cancer screening may help prevent those certain types of cancers, so such as cervical cancer and colorectal cancer, by finding changes in the body or in the cells before cancer even is formed. So it's in that pre-cancer stage. The cells are just starting to change into what could lead to or what will lead to cancer. Cancer screening helps find cancer early before you have symptoms and when it's easy to treat. Cancer screening helps find cancer before it spreads when it's easiest to treat. An early detection may mean less treatment and less time spent recovering. The earlier a cancer is detected, the better the chance of survival is as well, and the lower the chances of people dying of their disease. Now, there are some limitations of cancer screening. Sometimes tests suggest that someone might have cancer and they don't. We call this a false positive. It can be really scary for some, but the important part is that those tests only give us an idea that more testing needs to be done. So then it means that people need to get those further tests to confirm whether or not it is cancer. Some tests may not detect cancer even though it's present. This is called a false negative. And that's one of the reasons we screen at regular intervals. So either every 2 years, every 3 years, depending on the type of test. And some cancers would not necessarily lead to death or a decreased quality of life. So there could be an overdiagnosis of some cancers. And that's why we only have screening programs for some types of cancer, where we might not see that same benefit in the population if we're doing screening for other types of cancer. And then lastly, one of the limitations of cancer screening is that having screening tests may lead to doing more tests and having more procedures that are harmful, especially where cancer isn't diagnosed. Now, if you're looking to find more information, you can go to the Cancer Care Manitoba website, and there is a page for screening. And the amazing thing is there are videos and some translated information to learn more. Okay, let's go on to our next poll, our fourth poll. The question is, or what we hear sometimes is, I have other priorities and responsibilities. I can't afford to miss work. I can't find a way to get to a medical appointment when it's not something serious. The question, it's better to wait until you have symptoms before taking time off for screening. True or false? Okay, let's see the results. False. We are on a perfect streak here. So, what I want people to take away here is taking time for screening protects health long term. Taking time for screening can reduce or even lower the chances of long term health effects from cancer. And of course, it reduces death from cancer. So, what the research tells us is that finding cancer early through screening can reduce death from cancers like breast cancer by 20 to 30%. Also, there can be up to an 80% decrease in death from cervical cancer following the introduction. We could see that in research where they looked at populations where screening programs were put in place using the PAP test. And a large study that looked at long term effectiveness of using the test we use for colorectal screening with a population based screening program, we saw that it reduced the rate of death from colorectal cancer by 40%. So we can see these significant changes or lowering of the rate of death where we can detect cancer early. Also, we can see a difference in the number of cancers that are diagnosed. So, diagnostic follow up of an abnormal cervical or colorectal screening test can actually prevent cancer. So, we can lower the number of certain cancers being diagnosed if we're able to catch them before they are cancer. So, in that pre-cancerous stage. Also, earlier cancer detection means that we catch cancer at earlier stages before people have symptoms, which often means simpler treatment. There's more treatment options in many cases, and there's less need for some types of treatment that may also have lots of side effects, such as some chemotherapy and radiation. Now, if there is a possible diagnosis of cancer, if somebody is told you might have cancer, Cancer Care Manitoba does have resources to support people. Cancer Navigation Services is available across the province and can help support people who have been told they have a suspicion or they might have cancer. These are nurse navigators who are specially trained nurses who have experience and expertise in supporting people with cancer and expert knowledge of cancer and cancer treatment. They can help people navigate barriers to care, especially where some people might not have primary care yet. So they might not have a doctor or nurse practitioner if they're new to Manitoba. They can connect people to important resources early, such as interpreter services, where it's really key to have a trained medical interpreter providing the information to people in a respectful and appropriate way. They can also help people understand the information that doctors or nurse practitioners may have told them about test results, such as a biopsy they have had, or where tissue or the mass has been tested to see what type of cancer it is, where they've had scans like MRIs or CT scans or x rays, where they've had blood tests, and they can help people interpret those results in a way that's meaningful to them. And again, they can do it with interpreters being involved very early and help set people up for success in their cancer journey, especially where they're experiencing barriers to care. And I feel that that's the best work that nurse navigators can do, is supporting people where the challenges in accessing care are a little bit different than what it might look like. Let's say if somebody has been used to navigating the Manitoba health system. Okay, now let's put up our final poll. True or false? My family thought my diagnosis meant I was going to die, and it was devastating. So the question is, a cancer diagnosis automatically means you're going to die. Is this true or false? Let's see these answers. I feel like the group is pretty quick. False. That's right. So a cancer diagnosis is absolutely frightening, but it doesn't always mean that someone will die from cancer. Nowadays, many cancers can be treated very effectively, especially when they're found early. Screening tests and paying attention to new or unusual symptoms and going to see a doctor or nurse practitioner at those early stages when cancer might be smaller, when it hasn't spread, and when it's easier to treat is key. Early detection means that treatments can remove or control the cancer completely, giving people an excellent chance of living a long, healthy life. And even when cancer is found at a later stage, when tumors or when cancer is bigger or it's spread across the body, there are still many treatment options, and more come every year. Advances in chemotherapy, immunotherapy, targeted therapies, radiation, and surgery can slow the growth of cancer, shrink tumors, and manage symptoms. These treatments can help people live longer and maintain a good quality of life. In some cases, cancers can be controlled for many years, similar to how other long term health conditions are managed. I've known people with very late stage disease who have lived 5 to 10 years longer than what they originally expected and are continuing to live thanks to some of these advances in cancer treatment and symptom control. Across all stages, care teams focus on providing the best possible outcomes and the best possible care, whether that means curing cancer, controlling it, or helping people live well for as long as possible. A cancer diagnosis is serious, but it is not the end of hope. Many people continue to live meaningful, fulfilling lives after a diagnosis. And this message is very important when someone may be frightened or scared of a new diagnosis that they've been given. Now, lastly, before we end the session, just go to the next slide. There are amazing services that exist out there, and finding help is available. I want to point people toward going to Manitoba 211. This can give people information that they need about resources in their area. They can find a family doctor, access transportation. They can help getting to appointments or needing help finding childcare. Also, cancer navigation services is a key resource where people may have a diagnosis of cancer. When they've been told they might have cancer, it's an important time to get connected and going to the Cancer Care Manitoba website and looking at the information for cancer navigation services. You can find a phone number to connect yourself to a cancer navigator. It doesn't have to be a referral from a healthcare provider. Someone who has been told they might have cancer can connect directly. So thank you all so much for your attention today. Thank you for the time. We're excited for our project, and we would be open to a couple of questions if we had time. Otherwise, thank you for attending today.
Thank you, Allison and Princess. And it was a very reassuring presentation. I think would probably help alleviate a lot of anxiety, health anxiety people might have, especially if they're newcomers to the province. Just a couple of questions to clarify. You mentioned that you have to live in Manitoba for 3 months before getting treatment from cancer care. Can you see a family physician before that time?
Yes, you can access services, emergency services, and some services such as programs like Bridge Care for people who have come as refugees or are under specific protections and safety in the country or in the province. And so there are ways to access health services. The reality, though, is if somebody who doesn't live in Manitoba or who isn't eligible for Manitoba health coverage is diagnosed with cancer, they may not be eligible for ongoing care. They may have to return to their home province or territory, or in cases where we see visitors coming from other countries. After emergency services and possible diagnosis, they'd very likely have to be supported to return home because most private insurance does not cover anything other than emergency services or some of those initial services.
Thank you. Thank you. Just another question. Is there a listing of supports is available for newcomers? And is there a process that you would suggest that they follow if they're feeling that they need additional support?
That is an amazing question, especially as we're going through our project and we're looking at consolidating those resources in a space and a place that it's easier to find if somebody identifies as a newcomer. Right now, on the Cancer Care Manitoba website, there is a space for patients to access general information about supportive services. And so there is a section of the website that says patients and family. And under that tab at the very top of our website, there's multiple links to supportive resources such as the Hope and Healing Program, to cancer navigation services, to resources like Patient and Family Conference for even recordings from previous years, and some of those key supports that people might want to get connected to as early as possible, like navigation or um, uh, getting connected to a counselor or a peer support program, a dietitian, a patient educator. There's lots of resources that are available on our website. It's just not currently ordered under a clear area for newcomers. Now, if people are looking for information about health resources across the province, that isn't specific to cancer, I'd encourage them to go to Manitoba 211. This is either an online resource or they can seek information in various ways. But the website is very easy to navigate by the type of concern or the type of question, and most specifically by the postal code. So if somebody is in the Paw or Thompson, they'll find resources in that area, or if they're in the southern part of the province, they'll find resources in that area. Also, there is information through really important programs that are specific for immigrants, thinking about Manitoba Association of Newcomer Serving Organizations. There are many links and resources on that website, and also for different immigration programs that exist in different parts of the province.
Okay, thank you so much. If anyone has any further questions, then you can type them into the Q&A. We may finish a little bit early at this point, and I think that we're having a break, I believe, for lunch after this, so we may have a little bit of an extended lunch. Also inviting people during that time if they want to visit any of the booths that are available. I will also be available in the Patient and Family Resource Center booth to answer any questions and maybe direct people to other resources and support. So please feel free to chat with me there. If there aren't any other questions, I'd just like to thank Allison and Princess one more time for joining us today and sharing the information that the valuable work that they're doing with newcomers for cancer care. And thank you all for being with us today.
Thank you so much.
Thank you, everyone.
We look forward to when you can see videos about all of those questions and answering the needs of folks in Manitoba who identify as newcomers who are working with us on these projects to create these tools and key resources.
Yes, thank you, everyone. Appreciate it.